last video. I wanted to be able to help people kind of understand some of the services that you guys offer. First and foremost, I want to make sure that we get the contact information for New Beginnings. So if somebody wanted to get in contact with you, what would be the best way?
Best way is to call 845-454-6392, 454-NEWB.
Okay, awesome. And, basically there you can make an appointment and come see Dr. Silverman and check out a lot of the services that he offers. So we're going to talk into some new stuff that they have. But before we do that, I want to make sure that they get all of the stuff that they currently offer on the table so that you guys can, if you are in the Poughkeepsie area, try them out and get to utilize their services. So, Dr. Silverman, what do you guys offer?
So I appreciate you, first of all, having me on. This is great. I think it's amazing what you've done. I mean, we're one of the first 10, I think, businesses to be involved, and how you've expanded this and made it what it is right now. Truly amazing. Truly amazing. So I'm a plastic surgeon here in Poughkeepsie, New York. I'm actually born and raised in Poughkeepsie also, so I came back to give my community the technology, state-of-the-art treatments that I learned and that I am still learning and trying to bring back to this community. We offer everything from cool sculpting, non-invasive way of losing fat, laser treatments, vaginal rejuvenation, whole host of injectables such as Botox. Newest medication is Quo, which is pretty amazing. This is for cellulite, so little dimples on your butt. I've never seen a treatment that I was really impressed with besides this treatment. It's FDA approved, it's injections, and I'm really excited to bring that in to the community. And then we have, I do tummy tucks and breast augmentations. We do IV infusions here, which is a great way to hydrate yourself, get those vitamins and minerals, and also protect yourself from, some of these colds that are going around. Obviously, COVID. It's not going to protect you from COVID, but can decrease symptoms probably with the vitamin C and glutathione, which are antioxidants and kind of eat up the bad stuff in our system.
Yeah.
That's a. Yeah, and then we have two estheticians that do full array of facials and chemical peels. So I was going to say that, like, you have all these wide variety of different things. I've actually been a part of the some of the esthetician stuff. I actually did some laser removal on my neck. And it actually worked for a good amount of time. I didn't do all the sessions because, he's yelling at me right now already. But, if you're somebody that has a beard and you want to be able to get this so that you don't have to worry about shaving your neck anymore, that would be just something that you would definitely want to do. We also did the IV infusion. And I didn't turn into Captain America, but I got pretty close. That would be just something that you would definitely want to do. We also did the IV infusion. And I didn't turn into Captain America, but I got pretty close. Let me tell you, a couple of minutes after I left here, I felt rejuvenated. I had more energy in the 3 weeks that I had that IV infusion than I've ever had in the last 20 years. That's great.
I'm almost 40, so
that's great.
I'm 40 in 2 months, guys. Right? So, but yeah. So now let's kind of get into the new stuff, and I know that it's something that I could kind of show an example of because it's pretty ironic that I'm here. It's for people that have hair loss, all right? But kind of, I have a little bit, a little bit, guys, right? But tell us, a little bit about what this, is it hair transplant, hair restoration? What kind of products do you have now? What is it called?
Right. So we just basically brought in two big, machines. One is called Neograft and one is called the Artist. And just to kind of step back a little bit, there's about 50 million men in the United States that deal with hair loss. Okay, 30 million women. So it's 50 million, 30 million. That's pretty close. I didn't really think the numbers were that high for women, but it is.
Okay.
A lot of women have a lot of thinning and stuff, and then obviously men have male pattern baldness. Exactly.
I'll just keep raising my hand through this whole thing.
Exactly. So this is something that really affects people's confidence. It really, when you talk about workforce, people missing work and stuff like that because they're not confident about themselves. Some of it stems from how they feel about themselves. And if you are dealing with hair loss, that's a big thing. It's something you see every day, or someone that's is in your environment sees every day. So if you can make someone feel better about themselves by restoring something you see every day, or someone that's, is in your environment sees every day. So if you can make someone feel better about themselves by restoring their hair pattern, that's an amazing thing.
Yeah.
Amazing thing.
Yeah.
So what NeoGraft is basically a machine that you kind of semi-manually actually remove what we call the follicle units. So the hair, let's say, so the harvest site is on the back.
You can use me
back
as an
of your
example.
head.
That's fine.
So if we were to, we would basically take the hair follicles from the back of the head, okay, and
better view.
and literally take them out, okay, and then harvest all of them, and then we would actually transplant them to the front or the area of baldness. And then the other machine is called the Artis. Artis is a robotic machine that uses AI, artificial intelligence. It has 44 micron accuracy, which is half the width of a human hair. So just imagine that. I mean, how accurate something is that can see and differentiate the half a width of a hair follicle.
Okay.
And then actually, the robotic arm is actually the robotic arm. It's the KUKA robotic arm that's actually used by SpaceX, by NASA. So I mean, this is very, very advanced technology. I am super, super excited to bring it to the Hudson Valley. I think a lot of patients will benefit from this procedure. I really do.
So now talking about it a little bit, who would be the proper candidate? Now I know that I have a good amount of loss, and I've kind of been bald for a while now. Would you say
you're not bald?
I'm not. Well,
you're receding.
Yeah, sure. Whatever you say. In my eyes, I'm bald. But I have family members that are completely bald, up to the whole
dome.
Yeah, the whole thing.
Yeah.
But I also have, as you can see, I have some loss here. So is there a determination on how much loss, or is there no real difference?
Well, so there's a classification system called the Norwood classification, which kind of classifies people and how severe their hair loss is.
Okay.
From Norwood 1 to Norwood 7. And Norwood 7 would basically be everything all the way to the back. It leaves a little bit of strip in the back. Those patients, are most likely not candidates for hair transplantation.
Right.
If they are, you're not going to be able to transplant a lot of hair follicles, so it's not going to look that dense. With our patient here, he's thinning here, and then he's receding here. Now, what we don't want to do is we don't want to basically go like this, okay, and make a hairline like that, because then he's going to look like a 4-year-old, okay. So we want to basically kind of come back into this area. We want him to still have. A peak here, a receding, an area of recession, because that's more normal. And so we would kind of fill in this area, and then opposite side too, and then, so we're filling, this area and this area, and then this area is getting thin also. So then we would put, hair follicles in this area also.
I like how he's poking a pencil with it.
And it's
this comes off, right?
No, it's
permanent
too. So he would notice, hair growing in this area after about 6 months. It's kind of interesting. After the hair transplant, you'll lose those hair follicles, so people get a little worried. Oh, it didn't work. I lost my hair follicles. That's normal. Mm-hmm. Then they start growing, and you see results in about 6 months or so.
Okay.
And then usually at about a year's, you'll see full growth at that time.
Okay. Now, for somebody that is inquiring about it, they're basically going to call you the same number as New Beginnings, correct? Yep. And then from there, take us kind of through the process. So first you have to, of course, see if they're a candidate.
Correct.
Right? And then at that point, they make a schedule with you, and then they schedule the appointment and do it that way? Or how exactly does it go about?
Right. So we would do a consult. I would see you. We would go over your medical history, kind of try to figure out, okay, where are you in your hair loss, mm-hmm. right? It'd be nice to see pictures of relatives, mm-hmm. dad,
Which, by the way, I didn't get his genes because he still has a full head of hair.
Right.
Go figure.
Well, some of it comes from the dad side. Some of it comes from the mom side. But at least give us some idea of potentially what can happen.
Okay.
It's not always a direct science, but it's it gives us some information, and then we can kind of see where are you gonna potentially wind up.
Okay.
Okay. And there's other medications. Or there's medications that most people should be on also with hair loss, like minoxidil, Propecia. These medications will kind of stunt the hair loss.
Mm-hmm.
Okay, and then there's other things that we can do like injectables like PRP that can kind of give the scalp some nutrition. Increase the blood supply so that hopefully we're not seeing that hair loss and it's not progressing. Kind of, again, halting where you're at, or at least trying to slow that process down.
Okay. Yeah, I mean, with since I turned 30, maybe 32, I started losing my hair. For some people, it's a very eye-awakening thing. Like, you have to pull the trigger. Do I shave it all off?
Right.
Or do I do something about it? And
right. Do you own that being bald,
yeah.
Or do you try to do something?
See, me, I honestly, I have relatives that are bald. I have a nice round head. Let's shave it. But for a part of this, like throughout my loss, I've actually inquired, and a lot of you look into usually give you these weird side effects in some cases. But these two technologies that I've been hearing about, I mean, they're definitely something that gives you more of a normal pattern comparative to the traditional old-fashioned ways that you guys have heard about hair transplants.
And the other thing is, the other way, so this is what's called follicle unit extraction.
Okay.
So you're literally taking each follicle out, either by the neograph or the artist robot. The older way of doing it is called a strip method, okay, where basically you would remove like an ellipse of skin.
Just use me
you remove an ellipse of skin like here, okay, and then you would basically remove the hair follicles from that strip of skin. And then you would basically pull this together, and then you would have a big scar here. So there's some, well-known people that have had that, and you can see the scar in the back of their head and stuff like that. So it's
like a facelift and a hair transplant.
Exactly. So people, complain about the scar because a lot of times it is noticeable, especially if you have your hair cut short. There is more downtime. There's more pain with that way. With the artist and neograph, it's what we say. It's maximal comfort, minimal downtime. Most people don't even take pain medication afterwards. So
now, when they go through the procedure, are they local anesthetic?
Yes.
Okay.
Local anesthetic, completely awake. We give a little Valium to kind of relax them, and then you do what's called nerve blocks, where you're blocking. There's two nerves that come up here and some nerves in the back, so you put local anesthetic in there to block those nerves so that you don't feel anything. So pretty much your whole scalp becomes numb, so you don't feel anything.
Okay. Yeah, I mean, these are some cool things. I just want to, again, make sure that we capture some of the information from what you offer, but also how to contact you. So right now, this is New Beginnings Plastic and Reconstructive Surgery. If you guys want to check them out, they're actually in Poughkeepsie. The address, if you want to get here, is 4 Liberty Street. Now, it's kind of a weird area. Basically, if you go to Main Street on Poughkeepsie, they're in this alleyway. To the right, there's a door that has their logos on it. You can't miss it. It looks like this. They're on the 3rd floor, and the easiest way is to just call them and make an appointment. And again, that number is
845-454-6392.
Or the ending be new B, right?
That's right. NEWB.
Yeah. So they want you to have a new beginning. So a new B for a new you,
That's right.
And now that they offer a lot of these other services, you guys got to definitely check them out. They have a wide variety. The IV infusion, especially during these times, making sure that you keep your immune system up and your vitamins and minerals, because sometimes you don't even get that from the foods that you eat, is very important. So definitely want to try them out for that. Laser hair removal. Then if you don't want to go the other route, you know, you can get the hair transplant or the hair restoration, I should say.
Right.
So it's definitely a big difference between the two. So you definitely got to know which way you're going to go. But then you guys also have the cool sculpting, and you also have it's called
Viviv.
Viviv.
That's a vaginal rejuvenation machine.
Yeah, so they have a wide variety of stuff for you to partake in, help your body, help you become the new you, and you definitely want to check them out. So that being said, everybody, we're going to sign off. This is CE Avengers. Why get a geek when you get an Avenger? And I love local rewards, where your local is our local. I kind of messed that up a little bit, but hey, listen, guys, we're going to have the app coming out soon, so please check us out, follow us, and check out the journey that we have. We want to make sure that you find as many local businesses to help us keep our local economy in the United States going, and also to keep a lot of these business owners in place, because they are living off of the money that you bring in for them. With all that revenue, they actually can afford a home, afford a family in this, you know, times that we have now. A lot of businesses don't see that. So definitely check out a lot of the small businesses that are here and support them, because that is the USA thing to do. All right, guys. Talk to you soon.
Thank you.
All right.
That was good.
Yeah, just one. Yeah, no problem.